Welcome back to Breathe Easy, the ECU Health Respiratory Care podcast. Today we're talking about choosing the right post-extubation support, specifically non-invasive ventilation, high-flow nasal cannula, and conventional oxygen therapy. This episode is driven entirely by the evidence highlighted in our December newsletter, and we're going to walk through the actual studies and discuss what they mean for us at the bedside. Post-extubation respiratory failure is associated with increased ICU length of stay, higher reintubation rates, and increased mortality. Despite that, conventional oxygen therapy is still commonly used as default after extubation. The purpose of this episode is not to debate preferences, but to ask a simple question. Are our post-extubation choices aligned with the evidence? The first study is a randomized control trial published in JAMA comparing high-flow nasal cannula to conventional oxygen therapy in low-risk patients after extubation. The key finding was a significant reduction in reintubation. Reintubation occurred in 12.2% of patients receiving conventional oxygen therapy compared to the 4.9% of patients receiving high-flow nasal cannula. This represents a clinically meaningful reduction in post-extubation failure. A meta-analysis published in Critical Care evaluated high-flow nasal cannula versus conventional oxygen therapy across multiple studies. High-flow nasal cannula was associated with a lower risk of post-extubation respiratory failure with a relative risk of 0.61 and improved oxygenation as measured by PaO2. There was no significant difference in mortality, but fewer failures and fewer reintubations remain important outcomes. Study 3 was a 2025 study focusing on elderly cardiac surgery patients found that high-flow nasal cannula reduced bronchospasm compared to conventional oxygen therapy. However, this study did not demonstrate a significant difference in reintubation or mortality. This highlights that patient population and risk profile still matter when choosing post-extubation support. This randomized control trial compared high-flow nasal cannula and conventional oxygen therapy. Reintubation rates were 50% with conventional oxygen therapy, 20% with high-flow nasal cannula, and 20% with non-invasive ventilation. Both high-flow nasal cannula and non-invasive ventilation significantly outperformed conventional oxygen therapy, and ICU length of stay was shorter with high-flow nasal cannula and non-invasive ventilation. Once again, conventional oxygen therapy ranked as the poorest performer. A network meta-analysis published by the European Respiratory Society compared multiple post-extubation strategies. Key findings included non-invasive ventilation, both reintubation and mortality, high-flow nasal cannula reduced respiratory failure, especially in high-risk patients, and then conventional oxygen therapy ranked worst across outcomes. This analysis showed us to compare therapies even when head-to-head trials are limited. A 2025 meta-analysis in Frontiers in Medicine directly compared high-flow nasal cannula and non-invasive ventilation. High-flow nasal cannula was associated with improved PaO2, reduced reintubation compared to non-invasive ventilation, and no significant difference in mortality. This suggests high-flow nasal cannula may provide similar protection with improved tolerance in select patients. An observational study published in June 2025 showed that non-invasive ventilation improved oxygenation more aggressively, but high-flow nasal cannula had better comfort scores. Comfort matters because intolerance often leads to therapy failure. A network meta-analysis in eClinical Medicine focusing on obese ICU patients found that non-invasive ventilation combined with high-flow nasal cannula reduced both reintubation and mortality compared to high-flow nasal cannula or conventional oxygenation alone. An umbrella review published in Respiratory Medicine confirmed that high-flow nasal cannula and non-invasive ventilation both reduced reintubation compared to conventional oxygen therapy. Non-invasive ventilation carries a mortality benefit. High-flow nasal cannula offers better comfort and tolerance. Across these analyses, conventional oxygen therapy consistently ranks the lowest. So, what does this mean for practice? Conventional oxygen therapy should not always be the default after extubation. High-flow oxygen therapy is an excellent first-line option for many patients, particularly when tolerance is a concern, and non-invasive ventilation remains critical for higher-risk populations. The reason I chose this topic for this week's episode is to encourage conversations with our provider teams. The evidence around post-extubation support continues to evolve, and new data is always emerging. As clinicians, we need to keep our minds open, be willing to reassess our practices, and work together to apply new evidence thoughtfully at the bedside. And if you find yourself questioning or challenging the studies we discussed today, I would encourage you to consider complete your research education modules so you can actively participate in research and help generate the evidence that shapes future practice. These are not one-time decisions. They are ongoing clinical discussions, and respiratory therapists play a key role in guiding them. Thank you for listening to Breathe Easy, and you can find all of today's studies summarized on page 5 of the December newsletter. Until next time, keep advocating, keep questioning, and keep breathing easy.